got a problem. So does someone have a shoulder problem? Yay! Okay, so we want the worst person because it's so much more fun. I didn't say mentally, physically. So what have you got?
My shoulders pop out all the time.
Okay, so that's a dislocation. So that's a specific taping. And again, in terms of popping out all the time, then there's a mechanical imbalance. Now that does require some retraining. Kinesio taping is great, but it's not the be-all and end-all. When the tool is appropriate, it's amazing. So I can show you how to tape to limit the amount of apprehension in the area and allow you to increase movement. But the actual physical popping out, there's a laxity in the system.
Yeah, no, it's not so much an apprehension thing. I can get there straight after a dislocation. Like, I have no problem getting to range. It's just sort of more functional things, like when I'm carrying the shopping, when I'm squatting, or...
Okay, so is there anything that you can do right now that would make it very obvious for us?
Tug on it really hard.
No, okay. So that, no, because I don't want to dissipate you in the process of educating these guys at the same time. What have you got?
It's pretty chronic these days. A few years now, I had rotator cuff injury, had a bursitis that was removed. Now I've got scapular dyskinesis, so I'm pretty sure. So
Okay, so some cool stuff. Is there anything that you can physically do that would make you aware of this not being right, or any functional test that you, besides yanking your arm off and trying to pop it out?
Just pretty much full range abduction is sort of what I should have.
Abduction is...
But yeah, the scapula I'm talking about, not the shoulder now, sort of clunks and doesn't move properly.
Okay, so if I were to do some testing on you, I might find something there.
Certainly, it's about 6 months ago.
There's no one that can't throw a ball, can't do a push-up?
Yeah, I can't throw. I tried the other week. Couldn't throw.
Can you do a push-up as well? Or?
I can do a push-up, but I
Okay,
can't.
can't throw a
throwing,
ball. So
I felt it.
this. Okay, well come on, let's have a look at you. I'm sorry, you weren't bad. Well, actually not. You are bad, but it's just in terms of, I guess, your result, because yours is laxing, and I can't just make your tissue. But I can stimulate muscles to be better. So if I found a weakness in you, then I could do that. So sorry, your name? Cameron. Cameron, welcome, and thanks for volunteering your body to us, I'm sure. Okay, so look, there are 101 ways to do shoulder testing. I'm going to just try and find a quick one that find a weakness, so sit facing them, and find a weakness that we'll then be able to address and see if we can get an immediate response on camera. Okay, so he said he had a rotator cuff problem. Which side, by the way?
Right side.
Right side. So we're going to compare his right and left. So rotator cuff, so let's do his external rotation. It's in throwing, so I'm going to test him up here. You use your protocol as you go. Okay, I'm going to rest my elbow on the shoulder just to make sure I can feel as it pops up. I'm going to get my hand through here. And are you comforting her? She wasn't good enough for me.
Oh no, I'm
I'm on the inside. Yeah. It's not bad that you're not the worst. Hold there. Okay, so don't let me rotate your arm down. Hold there, don't let me rotate your arm down. He's trying. Is that painful or sore?
It's not actually.
Yeah, and it's a little bit weak. Hold there, don't let me push down. Let's try the other side because it could just be him. Hold there, don't let me push down. There's a difference. Can you see? Try this side again. So then we're because again, we're always comparing right to left. If both are equal, then that's just them. And if both are really, really weak, well then you're looking for a central source possibly. Hold there, don't let me rotate down. Yeah, he hitches first in preparation for the fact that he still fails. Hold it. Okay, so we can take that muscle to then see if we get a stimulation, but that's not necessarily where you feel your symptoms, is that right? Or
what I was talking about, the biggest problem for me at the moment is like, if I try to throw something, I feel it.
Feel all the way down through here. So can I get you to just stand up and maybe let's test, because the area he's saying is all the way down here, and possibly what muscle goes all the way down there? Lats. So let's just see. Now what does lats do? So again, think about your muscle function testing. Have you done muscle function testing? Good. Okay, so what does it do? It internally rotates, adducts and extends. So hold there, don't let me pull the other way. Is that painful?
No.
No?
Painful, no.
Yeah, hold there, don't let me pull out. It's a big muscle, it should be able to hold. Hold there, but again, that's uniform both sides though. Yeah, the amount of movement is consistent both sides, so it's not an issue of power that's your problem there, but let's just see the range. So if it's an internal, external rotate, take it up and go across, is that tight?
Yeah, feels tight.
Compared to the other side?
Can you do it?
Yeah, I'll add the extra bit. That's definitely more movement too. Does it feel easier for you?
Yeah, it's fine.
Yeah. Does his range look different, guys?
Yeah.
Yeah? Okay, cool. We can assess that too. So we're going to look for an assessment in range for his lats, and we're also going to do the external rotator, which is infraspinatus. Okay? So we want some strength to be regained in infraspinatus, and we want some length to be regained in his lats. Let's pick those two. Now, given his infraspinatus, have a seat, because I'm not tall. Okay, I tested it was weak, but I didn't test whether it was tight, did I? Because when I have my length tension curve, okay, a muscle can be weak by either being tight or just weak and long. Does that make sense? So in order to get some strength, I can either add some length to it or stimulate it to just get shorter in terms of recall. So, I know it's weak, but I don't know which end of that bell curve he's on. Yeah? So what I need to do now to confirm or figure out, what do I need to do? I need to test its length. So if the muscle's action is this, how would I test the length? So internally rotate, take it across your body and hug down. Compare it to the other side. That one. Uniform? Yeah. Okay. So I've got weakness, I've got uniform stuff, and so I can then think that it's just an issue of weakness now. So if it's just an issue of weakness, it tells me that I'm possibly doing 25 to 35% tension on my tape to stimulate strength, whereas the lats, it's about length. It's not long enough, and so I'm thinking I want to put my tape on with 15 to 25% tension. Less tension stimulates more length. As a clinician, before I do all this, I want to prioritise my muscles too. What do I think is the key muscle? Because if I can unravel the key thing like I did on that girl, the rest of itself tends to sort itself out too. Okay. So in your situation, you're saying that you feel it all here. And if I think my patient's reliable and it's not too chronic and overburdened by other things, then I might just go with them. Or if there's something in their history that says to me, you know, I think it's more the infraspinatus, then I'm going to go with that first and then retest the other parameter too. Because if we're talking about fascia and reorganising the way the brain works, then I don't necessarily need to do everything. Because quite frankly, if we're talking about some of the dodgy bodies that walk through clinic doors, you could go to town on everything, but you know, you don't have time. So in this case, possibly the most significant thing for you as a patient, I would say, is the lats. Would that be right? That you feel it's most restricted? You felt that was more of a problem than the strength?
Yes, definitely.
Yeah, okay. So as a clinician, you still need to address the patient's need. And so when I'm given the toss-up as to what to do first, I'm going to do what is going to be validated by my patient. Because at the end of the day, he needs to feel comfortable with what I'm doing. Does that make sense? Now, as an aside, do you have back problems as well?
No.
No, but do you have
Foot problem.
opposite side?
Yeah.
Is it joint, as in?
No, it's
just
bursitis.
Okay. The reason I'm asking whether it's to the opposite side, because in terms of our fascial slings, that lats continues on with the opposite glutes, and the fascia in the glutes then continues on into the lower limb. So then I'd be thinking it's a sling that goes across and affecting that leg as well. And I've certainly had one of the javelin throwers come in where she had a shoulder problem, but it wasn't until we taped the foot and wrapped the tape around up higher that we then fixed the shoulder problem. So just an interesting thing, because if you actually did have active back pain, we actually might treat the back pain by taping this tube, but anyway. You're a bit boring because you don't have my Okay, so
The other thing was the scapula is sort of all over the place in infection as well. I was wondering what traps was causing this to be tight.
okay, so he's interested in lower traps, and I've already found two, but we can go to town on lower traps testing as well. So lower traps, how would you test lower traps, guys? Prone. Thumbs up. Not so ideal because the bed's here, obviously, guys. But anyway, we'll do what we can. Hold the thumb up, and don't just do one at a time, and don't let me push down. Hold there, don't let me push down. Other side though, because it could just be him. Hold there, don't let me push down. So it's not fantastic both sides. Do you feel the difference?
I felt a little bit stronger this side.
A little bit stronger, but a little bit. And again, your patient's validating what you do, so still important, not to say it isn't, but not on my hit list of things to do. Now, you're saying, because he's an educated patient and he says his scapular rhythm is all over the place. Now, is that because you feel it's all over the place or someone's telling you it's all over the place?
Oh, I feel it.
Okay, cool. As in cool for me, because when we tape him up, he actually may be able to be aware of that feeling of something being different, yeah?
Yeah.
So, okay, lats. So I'm going to get you to stretch the tissue, and because I know the lats is continuous with the opposite glute, I'm going to do a myofascial stretch. I'm going to show you what you need to do, and you might look and think, oh, I'm not doing that. But we'll see how you go. You're going to get your leg up like that. That'll stretch the glutes. You're going to reach across, and then reach over to the opposite side of the bed like so, and if you can turn your palms up, even better. Okay? I need to put the body on stretch, yeah, to apply the tape. Yeah. Okay, so yeah, now, wait. See this foot here? It's really, it needs to be up here, because then you'll get a better stretch. I know, sorry. That's all right. You didn't know you were volunteering. Palmer. Okay, so what are we going to do? Where does lats go? Under and into the vertebral groove. So that would be really evil of me to actually stick that tape all the way up there, hey? And it goes down all the way to the iliac crest, and some attachments to the lower lumbar spine, transverse processes, the angle of the scapula there. Remember all this anatomy, guys? Of course. Okay, we decided it was tight or it was weak, guys. What was the priority? Yeah, so we want length. So you'll notice I put my tape, there's no tension. So I pull the tape off, I let the tape settle. Okay, no tension on the anchor. So basically that's it there. I'm going to go just next to it because I don't want to be too mean. Okay, palpate the stuff that I think is awful. Can you feel that? That's awful. Okay. Okay, so run my tape along there and then come down. When I get to the other end, I'm going to get the tape and let the tape settle again. Can you see how I tape off? And then, so with no tension, and then rub it in. And if I thought he was having a back problem, I'd go through the spine as well. Rub the tape to activate the glute. Can you feel that heat coming through? And coming back up. Now, obviously, I'm not going to test his length right now because you just did a mega stretch, right? So come around. Can you see the convolutions that we're talking about? Okay? Convolutions means taking pressure off the mechanoreceptors that would otherwise tell you this is really uncomfortable. Okay? So I'm not going to ask you to possibly do a range test, but I want you to try and throw for it so you can see that movement, because you're saying that that's what it feels like. And also do whatever test. How does that feel compared to what you normally feel?
It feels, down, like loose normally. It's all like that.
Yeah, and then, you know, you were saying that you feel your scapular mechanics aren't quite normal. So the test that you normally do for yourself that validates, because your patients may not be able to verbalise what they do, that they feel this problem in. Just let them do it. So,
Just reaching up and pulling out. But
okay.
Yeah, I still feel it.
Whereabouts?
Sorry.
Whereabouts? Because I'm interested in those mechanoreceptors that haven't got the stimulation. If I've got tape over it, hunky-dory. I know that it's just going to be a little bit of time, but where do you feel?
I actually feel the slight pain in my shoulder, but with my scapula it feels like it's not doing what it should. And sitting on
You want some protraction? Is that what you're talking about, or you're? He's hitching.
Just there, it's hitching just there. That's what I can't.
Yeah, it's hitching. Yeah, come back down again. You can see his shoulder's hitching a little bit high on that side. So let's just test his external rotation. Can you see as he does that, there's a little bit of a hitch going through here. The other thing, I don't know if you guys noticed, but there was fasciculations in his deltoids.
Yeah.
Did you see the shapes going on? I didn't test the deltoid because I just wanted to test a couple of muscles, but it may be worth testing that. So anyway, let's just test this other one for a tick. Hold there, don't let me push down. Still a little bit weak but stronger. Yeah. But I want to test this deltoid here. Hold there, don't let me push down. Hold there, don't let me push down. There's nothing in that, right? Hold there, don't let me push down. Let's do the other side. Hold there, don't let me push down. Can you feel the difference?
Yeah.
Yeah? Hold there, don't let me push down. Okay, I want someone else.
It's actually activating now.
Alright, so
Yeah.
you're compensating.
Yeah.
Oh yeah, I can feel the trigger points on that. So I might, if there's lots of trigger points in there, I might be thinking I'm going to take that to relax that as well, but apparently this is weak. Can I get an independent assessor, tester, come up here, and you can just test the deltoids, because then I'll take him and then you can retest him for me, because obviously, you know.
Oh, yeah, true. It's hard not to.
Yeah, so hold there and just test his power. Yeah? So you've got a comparison, right? And I want to be specific, is it anterior or posterior deltoid? So let's turn your arm down, let's test posterior deltoid. I'm going to come up and put my body weight because I'm weak. So I'm going to, that's not too bad. Can you feel that you can hold that one? Okay? But the middle deltoids are the problem, okay? Anterior is a bit worse, so let's come around the front.
Yeah.
Wait. Just bend your elbows up and take it out that way, there. And I'm going to point you down. That's not too bad. Yeah. It just feels worse, but it's the middle. Okay. Fascially, it's connected up here, tissue-wise, with the upper trapezius. Feel that bulk in there? Yeah? Can you feel that that is really, really tight? Independent assessor, feel this. Compare it to the outside. So it's only, this stuff is only worthwhile, and I think you will look amazing in pink. So, yeah, goes with hair. Okay, so those of you upper trapezius, do you know the test for upper trapezius? Shoulder shrug. So you can either do the shoulder shrug, or because I want to test it specifically one direction, just shrug up and hold there. I'm going to separate the two. Okay, that's weak. Hold there. You know your trapezius is really tight, and you really shouldn't be able to budge your head, budge anyone's shoulders or head. So let me now get you to rotate that way. Hold there. See that? I can't budge. Whereas this one. Separate the two. So he's got issues in there. So it's tight and it's weak. Can you feel it?
Yeah.
Okay, so because rather than just do deltoids, if I'm looking at coordinating the body, it would make more sense if there's something else in this biomechanical chain to go up that biomechanical chain and address all of it with one strip of tape. Does that make sense? Rather than just doing segmental muscles. So in this case, I want to do a little bit of his upper trapezius. I want it to relax. His deltoids, well, I haven't figured out whether it's tight and weak or just weak, have I? So can I just get you to do a deltoid stretch and tell me whether it's tight? It's hard with the middle deltoids because you can't really tell. You can't really put your body through yourself to actually test the length of it. So, yeah. So the best thing you can do is actually get the patient to stretch as much as you can and also palpate. And it doesn't feel tight, but can you feel all those tight bits in there as well?
Yeah.
Okay. Yeah. So they're the ones I'm going to go through. So in this case, I'm actually going to relax everything, but with the intent to strengthen. Does that make sense, guys? Okay, stretching things out.
Does the tape affect it if you lay other layers of tape over the top?
Yeah, so the idea is to stimulate directly on skin. So if you layer one tape over the other, you're not going to have direct stimulation from the second layer. Yeah.
So if you've got like a cross pattern.
Yeah. So that area where the cross comes up, because the direction of the tension, the tape recall is important. So in cases you will overlap, but then you have to figure out which is your priority. Do your priorities first, and then the other ones, you know, if they overlap, it's not going to be a huge problem. So if I'm doing fascia taping, for instance, I'll do the fascia first because that's the key thing, and then I'll add my muscle taping afterwards. Now, this here is continuous, so the fascia here continues down into the elbow, the lateral elbow, so I don't mind that my tape's a little bit long because the tissue is continuous. Grab the tape to activate the glue. And hold your arm up there, don't let me push down. Now there's a difference, can you feel that? Okay. Take your arm up and see how it feels again. How's that feel? Okay, so now let's, yeah, so how's that feel? So it feels a heaps better for you. And you know what? The thing is, it feels better but doesn't feel restrictive, does it? You got full range of motion, with the power restored, and let's just test the lats again because I've given enough time not to actually stretch it out.
Yeah.
Test your reach compared to the.
Sorry, that's it. Yeah, right.
You good?
Yeah.
Okay, and I didn't have to bash him too much to achieve it, which is the cool thing. Thanks,
Cool.
thanks so much.
Thank you.
Okay, so what we're going to do, guys, is we're going to try and do